I cannot. There we go. All right, and unfortunately, I cannot see you. For some reason, my screen has gone wonky. There it is. There you are. So I'm going to start by, introducing my partner in crime, Susan Shepard Carlson, working on policy with me, and then also my colleague Chris Melfi, who's been increasingly working on policy, and really appreciate his efforts. Tom Donaldson, CEO of FASD United, and Susan Ellsworth of the our affiliate network. And Tom, I don't know if you want to dive into any updates before we really get going.
Oh, maybe I'll say a word or two. Jen, everyone, how do you do? Good to see you. I hope some of you are in Seattle in a couple of weeks for the conference, so we're very excited about that. I'm sure Jen will have a word about that, and Impact Week. Not too early to think about Impact Week here in DC in September. I think I think Monday, September 16th, it begins. And the only other thing I wanted to say, the team is now working on a proposal for funding to be able to provide support, capacity building assistance to affiliates. And in one particular area that's so important is sort of advancing policy. So we're working on that proposal now. Hopefully we'll be successful. We'll have some additional funds. I think we all know, as why we do this, that the policy area is so important to make advances there. So that's one highlight at the moment. Thanks, Jan.
Thank you, Tom. So yes, hoping to see a whole lot of you at the research conference in Seattle coming up. We will be hopefully at the conference releasing dates for next year. Hint, March, hint, hint, for next year. So just want to give you a little bit of a teaser there. For those of you that can't make it, we are going to be recording the plenaries and releasing those out on our YouTube channel. So if you can't be there with us in person, at least you could be there with us partially in spirit. And there's a QR code if you want more information on the conference that you can link to, or just go to our website. It's all over it. So working on the Respect Act. I don't know if I see anybody new who has not been exposed to what the Respect Act is, but that's HR 3946 and Senate Bill 1800, introduced by Representatives Bacon and Murkowski and Senators Bacon and McCollum, and Senators Klobuchar and Murkowski. And this is our second shot at getting this particular bill passed, and we're making some good headway. Just updating on where we're at. The bill has made it through the Senate Help Committee. That's Health, Education, Labor, and Pensions, which is the furthest an FASD bill has made it in the last 20 some odd years. So that's pretty exciting. And the bill has been incorporated into the Support Reauthorization Act on the Senate side, which we are told is hopefully going to pass during the lame duck session, which is the session, the period of time after the election. That way everybody's done making their political statements, hopefully, and they're going to get down to the business of legislating. It has not been an overly productive Congress. There have been, sorry?
Historically, we look at how many bills have passed. Historically, it's the worst of all Congresses.
Yeah, they have not been passing many bills this legislative session. In this Congress last 2 years, we are in year 2. So we have until December to get this bill passed. Otherwise, we got to start all over again. And we're not looking forward to that. So we've made some inroads and some headway on hopefully giving us a little bit more oomph to get the things from the bill that we need passed. And so Susan and I were in DC just a couple of weeks ago, and with the bill, and when you get a bill passed, if the bill does not have money built into it, and even if it does, you still have to go through the appropriations process. And the appropriations are what kind of sets the budget and gives the money to the agencies to do the work. So they just passed the budget for fiscal year 2024. And unfortunately, there were not any increases for any of the FASD line items. Not for lack of trying, we did put in appropriations requests last when they were due for fiscal year 2024. Again, I think with it being an election year and with spending being a key focus of the Republican side of the aisle, unfortunately, that's where we're at, because it took, they were supposed to have this budget passed. How many months ago was that, Susan?
September
Sorry?
September 30th. And, it is frustrating that, once you get into a budget, it's really hard to get out of it, but it's really hard to get, if it's not been in a budget, it's really hard to get into a budget. Incrementally trying to make a difference. You've seen these numbers in some of the materials, historical funding. For instance, CDC was 10 million when it was first funded in 2001. It's 11.5 million now for CDC. So in 23 years, and they didn't change it in 2024. So that's why getting this authorization on reauthorization for the Respect Act is so important, that you just can't move those numbers incrementally. And so FY20, so it was 11.5 for CDC. It was 1 million for HRSA, which is not authorized, but that's been in for a line item for a few years. And the DOD did not get, which we had for FY22 and 23, did not get any appropriations in 24. So our work was cut out for it. And that's why we went, because we wanted to talk to a lot of the staff, that appropriation staff that will be making those decisions for FY 2025. So that's kind of where we're at with, and so we'll talk a little bit about our 2025.
And there's a question in the chat, Susan, about SAMHSA. Didn't SAMHSA get funding into the new budget? And I know you were going through line item by line item on that.
No, there's no line item in SAMHSA for FASD. There's one program that has, if you Google, or not Google, do a search in the SAMHSA language, one program that provides, it says FASD for screening, but there's no funding specifically set for FASD. So, and that particular program says that it has to do with substance abuse for pregnant women, and there is some training, but they've made that decision. There's nothing in the line item specifically set for FASD.
So looking at 2025, this is one of the big reasons why we went to the Hill, because squeaky wheel, right? We wanted to really be connecting and talking to the appropriators and meeting with as many appropriators as we could, because the only thing that's going to get the federal spending for FASD up really is that legwork. And so we met with a number of the appropriators offices, and in addition to putting in and talking to them, and then putting in appropriations for HHS, so looking at funding, refunding the Center for Excellence through appropriations, even if the bill isn't passed yet. And then looking at continuing to fund the Department of Defense project, which is really turning into something kind of cool because the model they're building is something they want to be able to replicate in the civilian population. So when they do things in within the DoD, one of their missions is to replicate in civilian populations, and they're working on a hub and spoke model of diagnosis that can be done using telehealth. And so when we were having a conversation with one of the defense appropriators offices, she mentioned that she used to do appropriations on agriculture. And she told us this great story about how it's really hard to get appropriations in through Health and Human Services. But that nobody really looks at the agriculture budget. And for example, it really bothered her that there was a $5 million line item that got funded every year for agriculture to get pesticide to eradicate a bug that hasn't been found in the US in 50 years. And so she suggested that we might want to really deeply dive into the agriculture budget and the line items there, because they also cover things such as telehealth and health services to rural populations. And there's a whole bunch of things tucked into agriculture. And so she was really helpful in pointing out some areas that her boss would be supportive of us tucking some funding, federal funding in under the agriculture appropriations. So that's why it's there. You wouldn't think that agriculture would be the place to get things moving for FASD diagnosis and FASD telehealth, but hey, we'll take what we can get. And if there's an opportunity to move things in the right direction, we'll do that. So, Liz, I saw that you had your hand up.
Yeah, as you know, I'm relatively new to all this, but I'm trying to learn as much as I can. And I'm a little confused between the link between the RESPECT Act and the process for appropriations. And I was thinking that if that RESPECT Act isn't passed, then the appropriations is a completely different process whereby you've described it, where you're trying to, for lack of a better word, piecemeal, try to get funding in for FASD for these various things. But I'm confused as to what would happen if the FASD RESPECT Act was passed. How does that impact your ability to get appropriations allotted for those, all the things that are called out in the FASD RESPECT Act? I'm just trying to understand this.
That is a really good question, and I really appreciate you bringing that up, because honestly, if you're confused about it, I can guarantee there's other people on this call that are confused about it too. And so I'm going to layperson explain it, and then Susan's going to explain it probably the right way. But what happens if the RESPECT Act passes is it shows congressional will for funding under those line items that we need funding for. There's no money in the RESPECT Act right now. So when the RESPECT Act passes, we'd have to go back and ask for appropriations, but we'd have a stronger ask because there's a bill and there's authorization set aside for it. So it would add those line items in, so there could be funding instead of us having to find line items to add funding to. Does that make sense?
And the same would be true if it got passed through the reauthorization, correct?
Correct.
With the same thing. Okay. All right.
Correct.
All
yeah.
right.
Yeah. And so, go ahead, Susan.
Right now, the authorization for FASD funding has expired. Okay, so there's no authorization other than what in CDC, there's in their code, there's FASD, and that's it. And then in an NIAAA, they're the only ones that have authorization. Now Congress can appropriate without an authorization, But if they have an authorization, that, and Jen's right, that, I mean, it's something that has been authorized, and so they should fund it, and it says such sums as necessary. So staff has, you know, we've been in a lot of communication with staff as what that would be. Obviously, it'll be what it's currently funded. And what was the Center for Excellence funded before? And that was 10 million. So, and then the building FASD state and tribal systems, that's a whole, and in the original Respect Act that we had last Congress, that was at 32 million. So those would be the minimum numbers that once it's authorized, that we would look at. So that's what we want to start looking, how can we get some numbers to up that so it won't be such a huge ask when we, you know, like. So that was kind of our mission when we had our discussions with the those are, we had meetings with McCollum staff, with Bacon staff, with Murkowski and Klobuchar staff about that.
Okay, so if the FASD Respect Act was signed before the end of the 1/18th, then more than likely it wouldn't be until FY 2025 appropriations that we would tie that additional.
Well, I mean,
whatever
it could
to-
happen. It could happen when they do the you know, at the end of the year during the lame duck. They could do it, especially if there's no, if they haven't done the FY 2025 until.
Okay.
If-
Okay,
That's
and then,
That's what we're kind of hoping for, that the Support Reauthorization Act will pass, or there'll be a combination that would in the FY 2025 is delayed until after the lame duck, because that would, so then that would be for 2025. So,
okay, and then, a related question,
yes.
I'm sorry, go ahead. Go ahead, you finish and I'll stop. I'll go ahead.
It's, you know, trying to predict what Congress is going to do is really difficult, but I think
Right.
we're in the best position that we've ever been. And sometimes I know we all get discouraged, and I get discouraged having worked in this field for 2.5 decades and seeing those dismal, pathetic numbers. I mean, it's just.
Yeah. Yeah, and I'm just trying to understand the linkages between how these things go together. But the comment that really threw me was when you, Jen, when you gave the example of agriculture where there's, you know, the pesticide thing for 5 million. So what that says is that somewhere in some legislation that there's a bill somewhere that keeps getting passed or is in perpetuity that allows for them to do that funding for that. Is that right?
So once you have a line item in appropriations, they very rarely get removed. So it doesn't mean that there's a bill that keeps getting passed to fund that.
Okay.
What that means is that line item is still there and nobody's bothered to take it out yet.
Okay.
And so this is where there's a little bit of fat on the bones in Congress. So there is some truth to, you know, congressional spending being, you know, I don't know that it's necessarily as bad as one side says or as good as the other side says, but, you know, this was an example, and she used that as an example of a way for us to get in. And the other thing we did, and I see your hand up, Joel, and I'll get to that in just a second. The other thing we did is there's a thing called report language that you can add into appropriations requests. And what report language is a request to the agency to add something as a priority in the agency's budget, even if it's not a line item for appropriations. Now, confusing as heck, I get it. I had to really pester Susan with all kinds of questions about this because it didn't make a whole lot of sense to me. But in a nutshell, that's what it is. It's Congress saying, hey, and we also want you to include in your budget funding specifically for this as in your existing budget. So we're not going to give you more money, but we want you to prioritize this when you're building your budget. So we did, for all of those things, also request report language be added in. Again, shifting funding to FASD.
And this was a real skinny budget for HHS. And we know that it's hard to get big increases in the HHS budget although Alzheimer's and cancer those were the two big items that got increases. Agriculture, they don't pay as much attention to. And so, and DOD is also another one that they don't pay, that there's a little more flexibility. So,
And for example, the House was not accepting new appropriations requests from legislators for congressionally directed spending for any labor HHS concerns. So any health and human services, you could not get those appropriations requests in. But you can for agriculture. So it's, you know, the old, I came home and watched The Sound of Music with my kids. It's one of my all-time favorites. And it's the whole, where God closes a door, sometimes he opens a window. Agriculture is a window. And so if we want to open that window, right? If there's a way to try and get some funding anywhere for FASD, let's try and do it. So sorry, Joel, please accept my apologies and ask your question.
Oh, no need to apologize. It's on the same order in regards to Liz's question. So what I'm understanding, because I'm new like Liz too to all of this, that we're trying to pass policy so that appropriations can be attached to it. And we're also looking for ways to tag in and apply for grants in other areas. Is that a more simple?
We're looking for ways to get funding to agencies so that they can allow grants. They have the money to have grants in other areas. So yes, that is simplistically, yes, that's exactly what we're trying to do.
Okay. And you just have lots of windows or doors you're trying to go through.
We are trying to pop into as many doors as possible. And I know Sid had a question in the chat, Susan. Apart from the legislation and appropriations, is it possible to prioritize targets within the executive branch agencies to raise questions of why FASD doesn't get proportionate attention? For example, and my mouse is covering this a little bit, so I apologize. Who is admitted for PPW treatment, and what do we know about home visiting population? Is EPSDT screening used for FASD, etc.? We're assuming we can influence the most dysfunctional part of the federal government, Congress, rather than the executive branch. And that's such a true statement, Sid. Do you want to take that one, Susan?
well, yeah, we are trying to influence the most dysfunctional part. I think the answer is yes. I mean, whatever I think there are things that you can do on the executive level. And, you know, the ICC FASD tries to figure out what's going on. But, you know, they're kind of a coordinating, and they don't have any you know, do anything policy wise. But in reality, it's, you know, Congress is the one that directs how, you know, money should be spent. And if you can get Congress to make this a priority, then you're gonna hopefully the agencies are gonna have to do it. And what the beauty of the Respect Act is it's a lot of that money goes back to the states, right? And so that's where the states are, you know, you're gonna have the states begin to look at those federal pots of money and how they can do you know, make those changes that you're talking about, Sid, in various categories. You know, like WIC is funded through the agriculture budget. So but I think it's both. If you had a lot of staff that could do that, we're just a little, you know, a little engine that could, and you guys are helping us with that. Yeah, the acronyms would be good to understand what those are. It's about as clear as mud, I think, don't you, Jen?
Yeah, I think it's any window door we can open. I will say that the Department of Defense was specifically, or the Department of Defense project was specifically requested through the executive branch to present at the State of the Science Symposium on some of the work that they're doing around FASD. So it is starting to take notice. EPSD is early and periodic screening, diagnosis, and treatment. And PPW, I'm assuming PPW is postpartum women. Please correct me if I'm wrong, Sid.
And what silo are those in? What are they?
Or proper, yeah,
Pregnant and parenting women.
pregnant and parenting women. Thank you.
Those SAMHSA funds or those HRSA
Yeah.
funds?
Yeah.
SAMHSA?
Yeah.
Yeah.
SAMHSA and HRSA, yeah.
Okay.
Oops. I hope we
So,
cleared
yeah, clear as mud, but all that to say, we have put in requests for additional funding for FASD for fiscal year 2025 and are continually meeting with appropriators to see if we can get some additional funding pushed through in addition to working on the FASD Respect Act. Teresa, you had a question?
Maybe, yeah, question, observation. And this is just how my mind works, but it is confusing. But it also just reminds me of so many articles I'm reading on, different news outlets, media outlets, that are helping to sort of explain to the layperson what's going on out there in various sectors of our society as everyone's trying to fight battles. To me, maybe this is a point in time where someone interviewing Tom or you or Susan talking about the work that's being done with this federal policy and all the, ins and outs of it. I think it would be fascinating for the reader to see why, the leading cause of developmental disabilities, right, is why the fight has to be this kind of fight to get funding. And it'll explain a lot about our process just to the ordinary, reader, but also, I think it would be great in terms of just getting the word out about FASD. That's just my 2 cents.
I think that's an excellent suggestion, Teresa, and definitely, as we something to talk about going forward. Yeah, I agree because Susan and I were just talking about this morning that this should not be so hard. This should not be so difficult. And what can we do to really highlight that amongst the population, but also with our legislators? Like this is ridiculous. So
go to the Capitol steps and I don't know, streak nude across the, up and down the steps. To get
okay, well,
someone to-
Susan, you're volunteering for that. I'm not, but although if it helps. So apologies. Brian, you had your hand up.
Yeah, thank you. And this is just more of a comment as we're talking about different areas to receive funding for this work. Here in Nevada, we've been able to get funding through some opioid state money. I saw a comment in the chat about that. The only difference is we couldn't just call it fetal alcohol spectrum disorder. We had to do prenatal drug effect as well. But through our patients, we saw that there's a strong correlation between the two. So we were able to get funding from there. And then as we're talking about SAMHSA, we're in our first year of funding from a substance use block grant where we didn't fit necessarily in any one of their funding buckets, but we made a strong case to get funding under prevention, as we talked about, making the diagnosis and getting them earlier as they're more susceptible to substance abuse problems later on in life, that the state recognized that it's a need if we can get them early, educate, make the diagnosis. It wasn't a ton of funding, but it was a start to actually open the door in the conversation with them of, hey, there's got to be a path for some funding for fetal alcohol spectrum disorder here, even though it doesn't fit necessarily all of your funding buckets.
And I think that's excellent, Brian, and I think as we've been doing this, you know, they do have a definition as we go through this for prenatal substance exposure that includes alcohol. So if we could get Congress, as they're doing a lot of these bills when they're talking about prenatal substance exposure, and to get away from you know, just saying neonatal or whatever, and so, and have them include alcohol in all of these, that would be helpful. In the meantime, for the states to be doing, you know, through the Respect Act, when is to do exactly that, but is to have the state working all of those programs and how they fit, rather than having the advocates always having to go and do it. So anyway, we probably should.
This is a great conversation though too, and I do want to recognize that Nevada really has been upping their game in terms of support for people with FASD through these creative mechanisms. And I would encourage you that when you're looking at potential grants through the state or even federally, because sometimes federal grants go out to state organizations, look at anything that has substance use attached to it, because alcohol is included in substance use. All right, March. Chris, did you want to take this, or do you, I can't remember what we decided here, and I apologize, but we did have quite a bit of activity in March.
You were going to take it.
Thank you. And just a lot of appreciation to all the folks that that set up meetings with their legislators. I know Ruben and Kristen there in Massachusetts have been doing quite a bit of work. The state of Texas is always knocking them out. And then some of the meetings that we did when we were up on the Hill are also listed there. We did get a new co-sponsor out of the great state of California. Thank you, California. And the folks in the different organizations making up FASD now. So we're moving. Just looking at coverage in terms of Senate co-sponsors and meetings. If you do not see your state listed there and you've met with your senator, please let Chris know so we can update that. And then House co-sponsors and meetings, same thing. If you do not see your state listed, please let us know and we'll get that updated. What do we want to continue doing? Definitely continue the meetings for the FASD Respect Act. Anything we can do to shore up support for the act is going to help. Continue to get endorsements. Endorsements for the bill, and we heard this from our appropriators, is very, very important. And I want to give a big shout out to the AUCD for endorsing the FASD Respect Act just recently. David Deere, I know you're on the call, and I appreciate all the work that you and now Elizabeth have done to help foster that relationship and bring that to fruition. And then just be active in your state. You know, all of this is going to come pouring into the states at some point. And so building the scaffolding so that you're ready for it when it happens is also a key factor. This is the part that Chris was going to take. We wanted to highlight some things that we're also doing in DC apart from the FASD Respect Act.
Yeah, thank you, Jen. Yeah, March was a super busy and productive month, and definitely a month that made me thankful that our office here is close enough to the Hill to get to by bus, because we were there 3 weeks in a row with our first event being the Capitol Hill Developmental Disabilities Resource Fair that was held on March 12th. Want to give a thank you and a shout out to Liz McHugh for making sure that we were aware of this and sending out some information about this. This was a great event that hadn't been put on since the pandemic. It was put on by the National Association of Councils on Developmental Disabilities and was sponsored by Representatives Mark Molinaro of New York and Debbie Dingle of Michigan. We were one of the 12 co-sponsors for this free event, which let us distribute materials on the FASD Respect Act to a few different congressional staffers that were there, and to connect with other organizations in the developmental disability space. As you can see from this picture here, I was joined by my coworkers, Andy Kacker and Emma Baldwin. And we are really, really looking forward to being able to attend more events like this and making sure that FASD has a voice at events like this. Not surprising, we were the only FASD prenatal alcohol exposure based organization there. There's a lot of organizations that are focused on autism or stigma. So it felt really nice being there. Both representatives took the time to speak with us about the FASD Respect Act before they got up and shared their own advocacy experiences surrounding developmental disabilities. But what we thought made this event so great was that it was really focused on the self-advocates that were present. They all got a chance to get up and speak and share their stories with all the organizations and congressional staffers that attended. David, that is a great question. I'm going to check in right after this to see if they are an endorser on there. Thank you, Jen. But we did make some great connections there. And Erin Prangley is their is their policy director. And it was great to get to talk to her about our policy directives and theirs as well. Some other organizations that were present there. Jen, you can keep it here. I'll jump to this one in just a second. The Autism Society, the Linner Foundation, AUCD, National Disabilities Rights Network, and the American Association of People with Disabilities. Last week, I was also able to attend a congressional research briefing up on the Hill. This was hosted by the Friends of the NIAAA, which is the National Institute on Alcohol Abuse and Alcoholism. This briefing was sponsored by Representative Paul Tonko of New York, who is a co-sponsor of the FASD Respect Act. And this was last Thursday. The point of this briefing was to allow researchers that are funded by the NIAAA to share their findings with congressional staffers and to highlight how the NIAAA supports research on the impact of alcohol use. There were 4 presentations in total. I have them listed out here. Not included is Dr. Koob's presentation just on the an overview of the NIAAA research. But I was pleased that each of the 4 presentations mentioned prenatal alcohol exposure. Also want to note that the event organizers distributed these slides for all the presentations. So if you're interested in seeing what they were talking about or more information on this, definitely send over an email or a call and I'd be happy to send those out to you.
Thanks, Chris. We are really working on being more visible and present whenever possible on the Hill. And I appreciate Chris's legwork and bus pass getting us there. So last month and even the month before, we talked about some, just switching gears slightly, sample legislation for a state advisory committee and a template for a governor's executive order for the state advisory committee. And I just wanted to invite any questions and then also ask if Sid, Annette, Rachel, or any of the members of FASD now, because I know you're working on working with using these templates among other research that you've done, and maybe talk to folks about ways that they might be able to either use the templates or other resources they might be able to find for working in their state and getting things going in their state. If you had any comments there.
I defer to Annette and Sid.
I defer to Annette.
Oh. I was just unmuted to defer to Sid. I have to say that we have a draft for an advisory committee. I guess we've been calling it where we've been legislation where we're trying to get a state coordinator. Sorry, Jen, I personally have not looked at these resources yet, so I can't say how we may have integrated any of this in our legislation. I know we've shared our work with you and Susan. So we are looking for sponsors of this legislation. And we're also, you know, looking at other windows and doors where we can get in and infiltrate our current state government. to get them to focus on FASD. So we will we'll come back to you with a better answer.
And that is just fine. I think really the beauty of what's happening in California is that it is a coordinated effort and it's involving multiple organizations throughout the state looking at it holistically. And I think that's the beauty of one of the many beauties of what FASD now is doing in the state of California. And this is where I would encourage all of you who are sitting back thinking, oh gosh, I'd really like to do something in my state, to start building those coalitions. And connecting with other organizations in your state who maybe should be involved but aren't, or are involved but maybe you're not working together, walking down the same path. So, oh, sorry, please go ahead, Sid.
We've found that approaching the organizations involved with disabilities, and some of those involved with children and family activities. Years ago, I worked at the Children's Defense Fund and got a sense of national and state advocacy. And in each of your states, some of those organizations touch on substance use, but may not understand the coexistence of use of illicit drugs and alcohol, and may not understand, as has already been pointed out, that resources available from the block grant, from substance use, for co-occurring mental health. A lot of agencies now are, as in California, converting to language about behavioral health funding. That includes substance use disorders, and that includes alcohol use disorders. So gathering the data in your state already available about plans of safe care, about referrals to the IDEA system, from special education. There's an amazing amount for all the data gaps. We found that in California, there was an amazing amount of data that was available at the state and the local level if you asked for it. Sometimes when you asked for it, they said, well, in the last few years, we saw one child that was diagnosed FASD. That was in a county of 3.3 million. That's a finding that they're not screening, they're not waiving the eligibility, they're not understanding why these kids should be in the caseload. Asking those questions of the local agencies and the state agencies has really been a critical part of our trying to build as broad a coalition as we can.
Thank you, Sid. That is excellent advice. Definitely no finding is a finding, right? And that's something to be pointing out. So look forward to hearing more about the success of what you all are doing. If you are working on state level policy, really would recommend checking in with us and just letting us know that you're working on something, because then if other people in the state want to get involved, we know who to direct them to, right? This is not about us trying to control who's doing it. It really is around who can we point you to, whether it's the affiliate in your state that's also working on it, or whether maybe you don't have an affiliate in your state who's working on it. Who can we connect you to so that you can start building those coalitions and making those changes? And again, would recommend that you connect with Chris. He's keeping track. He's keeping track and fielding most of those calls. So just a good best practice if you're working on it.
Susan, can I just ask a quick question before you move on? So back to what you were saying about, that at the federal level, there's the FASD Respect Act and there's appropriations. Is it fair to say that there could very well, there's a process going on at the state level, obviously for budgets and things like that, but that there may be funding in the state, if we find it, without all of the dominoes of the FASD Respect Act, to get more focus on FASD, irrespective of what goes on at the federal level? Is that sort of a follow-on to what California is doing? I just want to make sure I'm connecting the dots here. That's all.
Well, it's hard to connect dots, but each state, they get federal funding for certain silos, and they appropriate their own funding, maybe to supplement or to replace. And so this, that's why it's really important to, stay involved and do your state to figure out what's going on in the state. And like Nevada did, they were able to get pockets in various areas. Having the Respect Act, I think will really help bring that all together. But in the meantime, yeah. In Minnesota, we had, when I first got involved, we had no specific state funding for FASD. There was funding that came from the federal government for various things, but there was no specific funding. So,
Yeah, I think definitely getting involved at the state level, because there are, just like they're exploring in California, just like Nevada's exploring, there are those line items of funding that if you can, talk to your child welfare organization in the state, talk to your maternal child health, who's getting the maternal child health grants. I know Indiana does some of this too, where they're getting funding from the state. Not because there's an FASD line item in the state budget, but because, there's agriculture appropriations. I'm making a joke here. I know that it's, coming from other places, but yeah, being creative in how you look at how state funding is being used. And then making those connections and building those connections like Sid was referring to. So absolutely, Liz.
Some of you may have seen the Child Welfare League's 2-volume report on prenatal substance exposure, which had a almost proportionate focus on fetal alcohol spectrum disorders. It included the article we did on California, where we identified more than a dozen agencies that had roles in FASD or should have. And it's that kind of index, really, starting with conversations with the school district and moving on into your county or your state agencies at the local level and asking them, what are you doing about this? What counts do you have? And recognizing that you're going to get a lot of blank stares, which is an opportunity to refer them to all the FASD United resource materials that can do FASD 101 for staff who really don't know what they should be looking for and asking about. But it's the federal government annually spends $500 billion on programs intended to help children. The proportionate focus on FASD within that, we know, is inadequate. But it may be important to shop where the resources are and make sure we know which agencies we're targeting at the state and local level as well as nationally.
Excellent advice, Sid. Thank you. So one of the projects we have been working on here, and I want to give a big shout out to Heather French on our team for putting and pulling the data together, is some more information for state information sheets, looking specifically at what are the laws in the state around that kind of touch on FASD. And so I'd kind of like some opinions here. Originally we were looking at doing it as a state report card and kind of reporting out on these different areas and what have they done, but it's a little hard to quantify, what's an A versus a D versus an F. And your state's best. And there's a theory in advertising about, good news selling. There's a reason why, people want to be attached to winning causes. They don't necessarily want to be attached to negative causes. And so looking at these two side by side as a state report card, do we feel like grades are better, or check marks or things missing are better in terms of how we roll these out? Because we have the data for all 50 states. Now, I do want to say very clearly that we have not gone to the state of Alaska or the advocates in the state of Alaska yet to vet this particular information with them. And we want to do that in any state where we have action and activity, because we don't want to be releasing information and data that is different from what you're using in your state and messing up what you're working on. Personally, I kind of like the check marks, because I feel like if there are things that are done in the state that work, I'd like to have that noticed. And I would hate to have a sheet full of A's when there are people struggling in the state that don't think there's enough resources. But again, really open to any thoughts, questions, concerns. This is not the entirety of the data that we have, and happy to share that with you if you would like your state's information, before we put these out. But just wanted some thoughts.
Yeah, it looks like they like the checks better. I think when we were talking before, I think we liked the checks. And I did, there's a question about what Sid was talking about. There are two, and I don't know if you guys can see it, but there are two, the child welfare league put these out, and I had read, I've almost gotten through both of them. You can order them, and I don't know if there's anything where there's a link where you can get them electronically. I think you can, but you have to pay for it, right, Sid?
Yeah.
Yeah. Anyway, they're great. Lots of good information.
All right. Yeah, and Sid did put out the Child Welfare League of America that you can, he put that in the chat where you can find those. And yes, you do need to pay for them. It's not a free access link. Okay, so another piece of data that we have currently on our state information sheets, and there's been some conversation around this, is the cost of FASD. So where we have it listed here, say, for example, for Washington State at 4.71 billion. We wanted to go over with you how we came about those numbers, because in the sample legislation, the state legislation that we put out, it also lists, what the annual cost is. And so we want to give you the methodology that we used to put that together. So Susan kindly backtracked and went through. So I'm going to let you handle this piece, Susan.
Yeah, okay. So first of all, we know that good data, economic burden scarce. And a lot of it's, and this is, goes back to our discussions that they aren't really, they're hardly, hard to be identified. And because children with FAS, and this, and all the numbers that we originally, that when you go back and look at where they've done economic costs, it's been on just FAS. So, but we've learned that it's obviously a serious public health problem, even if we don't know the exact costs, but it's tremendous. So let's get down to the numbers so you can see how we've calculated it. Okay, you can. So when you start looking, and Carl got me thinking about that. You look at where do you find what would be good to put on. And we went through this when we were doing our materials for the Respect Act as far as costs. So of course, you want to go to the Centers for Disease Control and what they have. And so this is what's on their website. And that's an old study, and it's 1998. And if you look at it, it says 4 billion annually. Okay. And you can see what that doesn't include. And then you can see that this was just based on FAS only. So the 4 billion annual number that you see on the CDC website it's old data. It doesn't include a lot, and it's just based on FAS only. So when we were going through this, and I was working with the late Dr. Sally Anderson on that, because she was with the ICC FASD for many years, and they've looked at this, and she says, Susan, that's old data, because I said, well, what number should we be using? So, okay, so then we went from there, next slide, to look at, there was, and this is what a lot of advocacy organizations have been quoting, is there was a research study published in 2018 that looked at all the various economic cost studies to date as of 2017. And that, and so, and they were, studies were not included if they did not include for FASD. And you can see what, and there's a lot of verbiage on the sheets. We want to make sure that you had this when, you know, when you afterwards with the PowerPoint. So this is where we're coming up with our per person extra cost. And it's interesting because the US cost studies, and there were 4 of them, you look at that number, 68,151, and which kind of skewed the number, but we aren't using and when you look at, and I went back and emailed Dr. Bird about this, and he also contacted Dr. Green-Meyer on these costs. And they all recommended a number. If you see the last check mark, the 22,810 is, oh, it should say for children, and the 24,308 for adults. And so if you combine that number, go to the next slide, and I'm going through this quickly because we're getting to the end of our hour. So if you look at, this is how it's calculated. So this is the population that the US Census of the US in January of this year. And when I talked to Sally about, well, what number should we use for prevalence? So you have to come up and she said, well, the best numbers that we have are from the May, from the May study. And the average, taking the average from that study, which is this number, the 6.7 million, times these costs. And that 23,804 is the average of the adult and children costs. And then I asked him about corrections because it didn't include corrections. And they took this correction, that was from a study done by Popova that said it was 30% of the total cost. So that brought it up to 31,000. And if you recall, our number that we've been using in our materials was 205. Well, now because of the increase in population, it's 208 billion. That's per year. And if you don't want to put the corrections in it, it's 160 billion. I think what's really important, these are 2017 numbers. We haven't increased these for inflation. So, and we could have done that, but we didn't. So that's what we've been using. It was 205 billion. It's now 208. But if you just go without the corrections, it's 160. But again, these numbers are based on older studies. They increased it to 2017 dollars, but we haven't increased it to 2023 or 24 data. So those, I know it's a lot of numbers, but I want to make sure that advocates, when you're using, that you kind of understand where we came from in getting to our numbers. Let's see. Oh, Carl wants to increase these for for inflation. Yeah, I mean, so that's what, and the next slide, I think, just went into a little more detail on the let's see, is that it for?
Well, and let's talk about that, because 2% prevalence rate is very conservative. Yes, absolutely. And there was conversation, I remember Susan telling me about her conversations with Sally Anderson about this, that, if we put in the 1 in 20, the 5%, and we know now that, even the 5% is a very conservative number. If we had come out with the 5% when the previous data had only shown 1%, that number might not be believed. What was Sally? I think that was Sally's statement.
Yeah, going from the CDC of 4 billion, which is that's a 2004 number. I mean, so that's a really old number. And then I think it was a half of a trillion or something. I mean, it was a lot of money. And we just thought, there's no way but Sally said, she almost had recommended that half a billion, 500, what? And I learned, you know, this is a trick if you're trying to figure out all these numbers on your phone, you have to turn your phone horizontally to make sure you can get it to go to billions. But so when you're doing your state costs, and we should probably be all on the same page. And so I hadn't done an updated one with the population, the US population, but that's what it is now. So but I think it would be appropriate to increase the per person cost to $24. And Carl, you did that, and it was 202 without corrections, 263 with. Anyway, we thought that would be helpful for you all.
And yes, corrections is prison/jail. Rachel,
It's-
you had a question?
This is so, I think this has huge potential to help us at the local level in our advocacy. If FASD United, Susan, could come out with either on your website, something we can refer to, that according to FASD United, the national voice on FASD, estimated costs are blah, blah, blah. And then given that, for example, California is such and such percentage of the national population, we estimate such and such. But to have this with your backing would be super helpful.
And Rachel, to clarify, we did have that information in the national data sheet on FASD,
Yep.
but it's the older numbers. And we do have that on the state data sheets for FASD that are currently out, the state FASD Respect Act ones.
It's this updated stuff that's.
Yes, yeah, exactly. We do need to update it with the update for inflation and update for population, because those numbers were done back in 2022, I believe. So yes.
That's still pretty recent, but yeah.
Yeah.
I mean, and Tom can address this as well. We're you know, getting CDC to do some updating on their website would be helpful. And to have an update. I mean, I think that all these economic cost studies that have been done, I mean, why can't we use that? I mean, even though they're old, and so, and not everyone in the spectrum is going to have all of these costs, so you have to be, careful with that. But then there are going to be that are going to have more costs, and this doesn't even include figures for lost productivity of the caregivers, right? I mean, so I think. But I think we at FASD United need to update our numbers and make a decision on the 23,804 and 31,000, whether we update those for inflation.
And I think we also need to be very careful in how we word things and very thoughtful in how we word things around the economic cost of not supporting FASD. Or not having resources or supports for FASD, because the last thing we want is to talk about people with FASD as though they're an economic burden, right? And so being very mindful of that as well. These are human beings. I wouldn't want to be referred to as an economic burden, right?
Yeah.
So yes, this is the cost of ignoring supports and resources for FASD. This is the cost of not dealing upstream with prenatal alcohol exposure, but just being very mindful of how those conversations are being had and how that information is being presented.
Well, and I know we're over, but that reminds me of something. I think it happens. There was a bill that passed Senator or Representative Burgess in the House that's beginning to look at how the Congressional Budget Office looks at prevention, in looking at it over over 30 years rather than over a 3-year period. So I think this would really fit into that. The lost, I mean, you've got prevention, but prevention is intervention, right? And so you're gonna reduce costs by intervention. So
Excellent.
that's it for, I think, for
Well, thank you all for joining. I know I had asked Chris to ask about talk a little bit about the state proclamation project. If you have not talked to Chris yet about getting a proclamation in your state, please do. We have all the information ready to go. It is literally plug and play. You can change it how you want, but connect with Chris if you have not done that yet. And thank you all for being here. Really appreciate your time, your energy, your attendance, and your advocacy.